All right. Hello, everybody, and welcome to the first ever episode of the BrOT podcast. I am your host, Adam, and today I'm joined by Gabby and Callie. Say hello, guys.
Hi.
Hey. And here we talk about all things occupational therapy and healthcare. And to kick things off, I just wanted to, talk a little bit about who we are, how we're related to occupational therapy, and really just kind of dig into some of the basic issues associated with the profession. So I'll go first if you guys are okay with that. Um, my name is Adam, like I said, and I got my bachelor's degree in exercise science. I then went on to a master's degree in exercise physiology and worked for the Department of, why am I blanking on this? It's because I'm being recorded. Basically, I worked for the state of Minnesota as a recreation therapist for a while before I eventually realized that occupational therapy was the profession for me. I got in Missouri, and I just moved down here and been doing that ever since. We're all OT students. We're going into our second year now. And Callie, Gabby, one of you guys want to jump in, talk a little bit about yourself?
Yeah, sure. My name's Callie, and I have a Bachelor of Science in Nutrition. Although throughout my time as an undergrad, I was always focused on OT, and I went through the struggle, as many students do, of applying to OT school, which can be a challenge in itself.
Oh, yeah.
I worked at a rehab inpatient hospital throughout my time as an undergrad just to kind of gain some experience, and it really helped me understand exactly what OTs do instead of just be told or read about it. It really gave me like real life experience working in a hospital. And then I worked in another state hospital inpatient as a tech, and I feel like my experience as a tech also really gave me that firsthand experience. And right now I'm just really enjoying OT school. I'm looking forward to graduating and getting started.
Oh, yeah. That's definitely what I'm looking forward to most. Gabby, anything tell us about yourself?
I got my undergrad in psychology, but that was after changing it like 3 times. And it's kind of interesting because, like, when I think about all my different majors, it kind of makes sense that I picked OT because OT is like a combination of all of those. And so, like, my first major was nursing. And so I quickly decided that it just wasn't really suited for me, but I still wanted to do something helping people, but I wasn't quite sure what. I didn't really have a whole lot of direction. And then I was in education for a year and decided that the pay, to be honest, wasn't going to be enough for me. I had a little moment to myself where I was like, you know what, I think for the amount of work that it takes to be a teacher, I really want to be compensated more than a teacher gets compensated. And that's not to say that, that just goes to show that teachers deserve way more.
Yeah.
So,
Well, yeah. I think, I feel like people always get very shy when they talk about, like, I want to get paid, like, good money.
yeah. And I was just honest with myself about it. I was like, that's just not what I'm willing to work for. So,
Well, and that's the thing. I feel like a lot of people, for a long time, like, were encouraged to be very intrinsically motivated. And that's a very good thing, but there's no shame in wanting to be well compensated and living like a good financially stable life for you and building that for yourself. I think that's something that everyone should consider when they're actually planning out their future, their professional, the direction they go professionally.
yeah.
So yeah, really, I think the takeaway there is that I know we're second year OT students at this point, so we're still kind of learning the ropes and learning the profession. But really, with this podcast, I wanted to talk about kind of our experiences so far, our perceptions of the field, and really just kind of get in on the ground floor of that experience so that anybody who's listening can get a sense of what it's like to learn about the field and live in the field and just kind of get a firsthand account. So the first thing I kind of want to jump into, aside from who we are, for anybody who doesn't know, or for someone who thinks they know and might be a little bit confused or off base, I'd like to start out with a question. What is occupational therapy?
Our favorite question.
Everybody's favorite question. Now, I know in our program, we go to an MSOT program. We're all classmates. They talk to us a lot about what they call like your elevator speech. Like if somebody if somebody asks you what is occupational therapy, the idea is you're supposed to have something in your back pocket where you can kind of give them the rundown in like a few seconds. Now, of course, when the pressure's on, that's a lot easier said than done.
Yes, especially considering lots of people have a different experience with healthcare in general. So I always try to relate it to, okay, do they know what a PT is? Do they at least know what a physical therapist is? Because if they say no, this is going to be a lot longer conversation.
Yeah, I think you're absolutely right. One thing I've noticed, like in OT, and this isn't universal, but like I feel like some OTs, they really want like, they don't want to just attach themselves to PT or speech. They're like, no, we're our own thing. We don't need to tell people about that. But no, like we do work hand in hand with PTs all the time. It's normal, it's expected. And I mean, whether we like it or not, PTs are currently, they've done a much better job of marketing themselves to the public. And I think there's much more recognition when it comes to PT versus OT. So starting things off by saying we work with PTs we make sure people are at least like in the right time zone before we start talking about anything else.
Yeah, and although OT does reach a lot of populations, a lot of different populations, I still feel like physical therapists interact with the more general population a lot more, just in terms of people get injuries, people are in car accidents and need to see a physical therapist, whereas for occupational therapy, that's usually more specialized circumstances, like a child with autism, someone who's had a stroke, although we are trying to incorporate ourselves into more populations, of course, but that is something that occupational therapy really does struggle with sometimes.
Yeah, and to make matters worse, sometimes OTs are mistaken for PTs. So
Oh yeah. Well, not just PTs, nurses. I mean, like all different kinds, and it's just really good to be really patient with your patients, and just because there's been times when I was a tech when people would ask me what OT was multiple times a day, because my patient would say, oh, I don't want to do PT, like I can walk fine. And so I'd have to explain to them. And really, that is such an important part of therapy, is the patient understanding what they are getting out of the therapy. So your ability to articulate how this is valuable to them will really contribute to how hard they work for you and how much they get out of the therapy itself. Because if they're thinking the whole time, like this is pointless, this is a waste of time, why am I doing this? Why am I doing this exercise? Then they're not going to be as devoted and possibly do the exercises that you give them to take home. So that's a really important part, I think.
Oh yeah, I mean, adherence is king at the end of the day. You can put together the best program for them, but if they don't do it, it doesn't matter.
So when you're an OT student and you have to explain what OT is constantly to your family, friends, and just people you meet on the street, you can see it as practice for when you need to explain to your patients why this is important to them.
Yeah,
for sure.
And I know so far I think we've talked about talking about what OT is, but I would like to take a crack at just sort of what I try to do when someone asks me or when someone doesn't know. So like when I talk about what is occupational therapy, for me, I start off by defining occupation. Now, this is one of the biggest misconceptions when it comes to our field, because one of the first things a lot of patients say when you walk in and say you're an occupational therapist is like, I don't need a job. It's like, no, when an occupational therapist is talking about occupation, they're really talking about everything that a person does in their daily life. So the stuff they need to do, the stuff they want to do, really everything that occupies their time. And what an occupational therapist does is use targeted, proven strategies to enhance their ability to perform those tasks. It can be things as simple as, going to the bathroom, dressing, bathing, and it can be stuff that's more complex, like, cooking or engaging in a hobby or a sport or doing makeup or something like that. Really, it's really kind of whatever matters to the person. The stuff they want to do, the stuff they have to do, the stuff that they need to do to function out in the world once they leave your clinic or the hospital or wherever they are. So that's really what we do. The word is overused at this point, I think, but we engage in kind of a holistic approach to therapy. And what I mean when I say holistic is, we try to look at every variable in a person's life and identify what variables can be adjusted to make them more functional. And that's where I come from, very kind of nuts and bolts. I know everybody kind of has a different approach to explaining OT, though. So is there anything either of you guys want to add?
I think, you kind of touched on it a little bit, but just like looking at every aspect of a person's life, including like, what resources they have also, like what is their family support like, what is their home like, what is their job like what accommodations are available to them and what supports do they have, I think is super, super important for us in particular as well.
Yeah. No, I completely agree. So that is one major hurdle that I feel like every occupational therapist has to face in their daily life.
And it's hard for me to just come up with like a general definition, just because, like I said, I try to gauge what the person's prior experience is and like really emphasize like what they'll understand best, because I have definitely gotten into kind of like a circular discussion where they get confused and it's like, okay, I'll try to explain it this way.
And to make matters worse, I feel like, and this is not a knock against anybody specifically, but I feel like most occupational therapists, maybe this is too bold to say, I feel like most of them love their job and they're really excited about it. So when they try to explain it to someone,
it's like they over-explain.
Yeah, they get really excited, and like maybe they don't necessarily spell it out as like concretely as the person might like. So that's one of the reasons I like to tether it to physical therapy, just because there is so much interplay between the two professions. And like if somebody knows what physical therapy is, then it's easier to kind of broaden that understanding to occupational therapy, since the two are very much, peas in a pod. So moving on, I wanted to talk a little bit about the admissions process, everybody's favorite thing in the whole wide world. And
I would totally go through that again.
Yeah, absolutely.
It was just for fun. I might just apply to a few other schools.
Just for funsies.
Sometimes I'll just get on OTCast just to check it out.
Just for the memories.
Nostalgia,
Old time's sake.
Just when I feel like having a panic attack for no reason, just out of nowhere.
Exactly. Now, see, if anyone has yet to pick up on our sarcasm, I mean, if you're someone who's considering occupational therapy as a profession, I mean, we're going to give it to you straight. Like the admissions process is very difficult. It's hard to get in. It's tough to like get all the resources you need and put everything together and, start applying to schools. I will say right off the bat, before we scare anybody off with admissions talk, occupational therapy pays very well. Most occupational therapists really enjoy their job. I think it's a great profession and you help a lot of people. So now that we're talking about some of like the less glamorous things, maybe keep that in mind.
It's not necessarily, I think part of like a major part of that is just that there are fewer schools compared to say like medical schools. Cause I know the state where I'm from, there was only one OT school in the whole state. Like they're beginning to start new programs, but that really limits the schools that you can apply to, especially if you're wanting to stay in your home state.
Oh, yeah.
So that's something that I would really stress is looking into, like depending on your resources, if it is at all possible to go out of state because I speak from experience in applying to the one school in my state the first year. I didn't get in because I just had all my eggs in one basket and I was so sure. I had worked throughout my entire undergrad, volunteered hours upon hours, was an honors student. And so getting that rejection letter for me was so surprising and really kind of devastating. But I kind of would stress to everyone out there that has experienced that or might experience that to like really just keep trying. And because I got in my second time and a lot of my classmates did as well. But I know it's really easy to say when you get that rejection letter and it's like, okay, what am I going to do for the rest of the year? I'm so sure.
Yeah.
So really maybe have a backup plan in terms of that so you can really just get back on the horse. If you took the GRE, study for that and just make a plan on how I retook a few classes. I mean, I'm not ashamed to say. And I found another job to really tide me over.
Yeah, your job experience makes a big difference. A lot of
In a
schools,
lot
for
of cases,
interviews.
Yeah.
And it is tough because every school kind of has different expectations and different
Yes.
demands for
yeah.
their candidates, which makes it a tough game to play. Now I'm gonna in a little bit I'm gonna dive into my experience a little bit, but I can go on and on. So Gabby, is there anything you want to talk about as far as your experience goes?
Yeah. I have the luxury of being from Missouri, and I feel like there's a lot of OT schools in Missouri compared to other states. Like, if I say,
Yeah, sure.
Arkansas only has like one.
Woo pig
or-
suey.
And so I think Missouri has like six or seven, and so I knew that I probably was just going to stay within my state because I had a lot of options there. But I did compare Missouri schools to other schools just to know, are Missouri schools harder to get into, easier to get into? What are most schools looking for as far as requirements go? Because most schools, they have different requirements, but a lot of them do overlap. Like a lot of the prereqs overlap.
That is true.
The observation hours, but one school might need 20 hours and I saw one school needed 80 hours. And so it's like, that makes a huge
You have to really
difference.
read the fine print of
Yeah.
the application because you might think you've got all the things checked off and
Yeah.
then it's like, oh, they require a super specific extra thing.
Yeah.
Yes, I
Like,
can, or you'll get an email back like, actually, that credit does not count.
yeah.
Okay.
Yeah.
Good to know.
Yeah. And then there were 2 years in between when I graduated from my undergrad and getting into OT school, and one of my credits was getting old, and I didn't know that it got old.
Like it expired.
Yeah,
or
like
it was,
5
or it was
years.
going to expire.
Yeah, because
Yeah.
a lot of especially your sciences, like anatomy, they don't accept
Yeah.
it after 5 years. And I took my first one in 2011, and I was like, oh,
Oh,
shit,
yeah.
it's
And see,
darn.
no, it's fine. We can we can
Leave it out.
We can do that once in a while.
Alright.
But no, it's fine. I know that's the thing. I honestly, looking back, I don't think I realized how under the gun I was when I was applying. Because, like I said when I was first introducing myself, I am kind of a non-traditional student. I have another master's degree in exercise physiology, and I was working for a year after that as in a career level job. It was the Department of Human Services, by the way. I finally remembered. Right, stage fright, I guess. But looking back, it took me 2 years to get into occupational therapy school, and in that time, looking back on it, man, I was just I was just under the wire as far as some of my prereqs are concerned. Because you need a lot of anatomy, a lot of physiology. Some programs that are especially sadistic require physics and a lot of chemistry and some other classes like that.
Specialized psychology classes.
Oh yeah, you'll see a lot of abnormal psych requirements.
That was one of the reasons why I majored in psych, was because after being in education actually requires a lot of psych, and so And then I was like, well, I just need to graduate and I just need to get into OT school. So I was like, what's going to make me graduate the fastest and get the requirements I need? And it was psych. So, I mean, I love psychology, but that wasn't, I knew I wasn't going into it with a like, I didn't want to be a psychologist, basically.
Yeah.
It was just to get into OT school, basically.
Well, yeah, I think
Yeah.
that is some really good foresight, though, because I think that's one other thing that kind of sets OT apart from PT is just the whole psychological component.
Oh yeah.
I mean, we work with a lot of people with autism, a lot of people with other, psychological abnormalities or deficits that, need where you need that extra training and that extra expertise to do your job well. And so, yeah, like I actually had one program that I applied to that had like, because I mean, the physics, the chemistry, the psychology, all that makes sense. You'll see some random stuff though.
Yeah.
I know one school that will remain nameless, well, I know they required, I think it was some type of philosophy class,
Oh.
Yeah.
like some very specific type of philosophy class. Like it wasn't even like an ethics class or anything. It was something else, like a philosophy and culture class or something
Yeah.
like that. And
Yeah.
just sometimes you'll get these requirements that come out of nowhere.
Yeah.
So like when it
It's
comes to
random, like apart from other schools, it's like it does not make sense. Like it makes sense, but it's like no other school's asking for that. Like why you? Why this school?
Yeah, and that's the thing. Like when it comes to like people who are interested in the profession and want to know how to get in, the first thing I encourage them to do is kind of shop around, look at where you want to go to school, the programs that look right for you, and kind of work backwards from there. Look at what their requirements are and do everything you can to fulfill those requirements. In some cases, it's prereqs. In some cases, it's the GRE. You guys can't see, but every time the GRE comes up in our conversations, I do a little dance because when this is over, when I get done with OT school and I graduate and everything's ready to go, I will have 2 master's degrees, and I never had to take the GRE, and I brag about it all the time.
Good for you.
Yeah, and like now, granted, like that said, if you really have your heart set on one specific program, and they require the GRE, you might have to end up taking the GRE if that's the school you really want to go to. But yeah, I talk to some people all the time who say, well, I can't get into OT school, like it's too late, I don't have what I need to get in. And in those cases, I encourage them to shop around, look at different programs, and find find the one or several that are most attainable to them. Because some of the ones that are like, some of the ones that consider themselves more prestigious or are kind of at the tippy top of academia, they might be a little bit unattainable for some people. But if you shop around, you can still find a good program that you can actually get into and is a good fit for you. Now, I've only kind of grazed the details of my own experience, but I will say, just to put things in perspective, and the thing is, some people, they apply to one school, they get into one school, and that's the end of their admission story.
That's what my sister did.
Yep.
Yep. My sister's an OT, and she got into the first school she applied to, and yeah.
And I know other people who that's the same, so you might have it easy if you decide to go to OT school. I know for me, just to put things in perspective as to how tough it can be, it took me 2 years to get in. And keep in mind, I have a pretty distinguished background for someone my age. I've done a lot of cool stuff. I'm very educated, coming in with another advanced degree, so I've proven I can prosper in that environment. But in my case, it took me 2 years to get in. First year, I applied to 10 schools, and I got not 10 rejections, but I got some rejections and a lot of waitlisting. And this isn't always the case, but sometimes a waitlist is just a glorified rejection.
Yeah.
Like that's not always the case, but for me it definitely was, because I never got a call back. And then second year, same deal. I applied to 10 schools, and one said yes, and here I am. That's I am not. I'm from a completely different part of the country, and this is just where I happen to get in. And I was like, well, I guess I'm like selling a bunch of my furniture, packing up all my stuff, and moving.
Yeah.
Sometimes if it's really what you want to do, like those are the types of sacrifices that you might have to make. And for me, it was worth it. I would do it. I would absolutely do it again. But yeah, it can be tough. The admissions process is not for the faint of heart. I know we mentioned briefly OT-CAS. And for anybody who doesn't know, OT-CAS is sort of like the national system, the national online system that's used to apply to occupational therapy school. If you want to get into OT school, I'd say 99% of the time, you're going through OT-CAS.
There are some random schools that don't use OTCAS, but
Yeah.
they're kind of hard to find. Like I struggled finding schools that didn't use OTCAS, so I think most of
Yeah.
them are changing to use it.
I think most schools do it because again,
It's
it's hard to
easy.
get noticed if you're
Yeah.
not part of
Yeah.
OT-CAS.
And I mean, one good thing I will say about OTCAS is it's very nice, even though it takes a long time to get all of your transcript classes into the system. Once it's in, you can use that same input
Yes.
for lots
Yes.
of all of
Yeah.
your
That is exactly
schools.
that's something
Yeah.
I was about to say the exact same
Yes,
thing.
but it's very important that you start that process early
Yes.
because
Yes.
you yourself you can pay, I believe, to have them submit your
Yeah.
for you to give them your transcript, your official transcript, and then they input all of your classes for you, or you can input your classes yourself and try to submit it, and they will likely send it back and tell you there's a problem with this credit, this wasn't inputted correctly.
Yeah.
And so I did that maybe 2 times.
Yeah, I think I
before-
tried to manually do it, and yeah, it kept getting rejected.
Yes,
so I
because-
just paid
Yeah.
to do it. Yeah,
Me too.
Yeah, yeah,
And that's the thing, like
And if there's a deadline, coming up, like
yeah.
that, you really have to set aside at least probably 3-4 months or probably multiple months to really make sure you've got.
Because then you have to get
your
verified.
application.
You have to like once you get all your stuff input, then it has to be verified, and that takes at least. I think my first year it took a long time. My first
I
year,
think
it took
they
like,
said to expect like 5 weeks
yeah.
or so.
It didn't. It wasn't
Yeah.
quite that long. I think it was like 3 weeks. But my second year, it was like 1 week. But it varies on their demand and what time of year
Yes,
and how many.
the same goes
people are
for
applying and
asking
stuff.
for like recommendation letters.
Yes.
Give
Oh,
those
yeah.
people a lot of notice.
Oh, yeah.
Make
That
sure they're
was
people
a
that'll
struggle
actually
for me.
give you a good recommendation.
Because they have to
Yeah.
send it to OTCAS.
yeah, it has
your
to be submitted.
references. Yeah.
It has to be submitted through the OT-CAS system. You can't just get a letter of recommendation and paste it in there.
Yeah.
It has to be like verified, and they have to go through that software and that system to make it official.
Yeah.
I know for me, one of the OTs that I was shadowing as part of my observation hours, very sweet lady, very supportive of me and my ambitions. But she was an older OT, and I ended up not being able to have her. I wasn't able to use her letter of recommendation because she couldn't figure out the software.
Oh, yeah. So I asked more people than was required.
Yeah.
Just
I
to
did
make
that too,
sure
yeah.
Oh yeah,
that
I think the requirement is
It's an
3,
extra.
but the maximum is like 5.
yeah,
I went
different
ahead and
programs
got-
require
Oh yeah,
different amounts and like different people too. Like some programs require that you have all OTs do your reference, and sometimes it's just managers.
yeah. I know for the programs or for the reference letters that I had, I think I had 3 OTs, 1 PT who was an old friend of mine, and then one of my old supervisors. And then the programs that I applied to were able and willing to take those. But yeah, different programs will have different requirements. And yeah, it's so really like the big takeaway here is like do all of this, like we said before, months in advance, because this is a process, and it's probably going to take more time than you expect. And sometimes it's not even just you getting it done. It's like we said, OTCAS verifying everything and you submitting everything to the schools you want before the deadline. It's a whole thing, and it's really hard. But I do want to stress, like OT is a great profession to be in. So don't let any of this, if you're thinking about it, make sure it's for you, but don't let the difficulty of admission scare you off. I know I could have given up after that first year because it was a pretty devastating defeat. I like to pretend that I took it in stride. We all know in the moment I didn't. So, like,
Oh no, I had my hopes up so bad for one school in particular, and I
Yeah.
got denied, and I bawled. I mean,
Yeah.
boo-hooed.
Me too.
It sucked. It was awful, and I was like, I was at work when I saw my rejection letter, and I had to like go to the bathroom to cry, and it was horrible.
yeah.
But yeah, I mean, and then, also if you do get waitlisted, like that can mean a glorified rejection, but it also puts you higher on the list next year. So if you get waitlisted and then reapply after a second year, you are going to stand out, I mean, majorly. Like it just shows how dedicated you are to that school. And so, I encourage people who get waitlisted to definitely reapply because it will help your chances of getting in.
Oh yeah. Really, it's just like anything else in life. If you get knocked down and this is really what you want, get back up again, try again. Don't just quit after the first time. It like lots of people have been in your shoes. Be patient with yourself. Just tighten up your application and try again next time. And just try to just find something productive to do in the meantime.
Yeah. I will say I in my forced gap year, my first year after getting rejected, my job at an inpatient hospital as a rehab tech, I learned so much. Like, obviously, I was devastated about not getting in the first time, but I still learned a ton because I had never worked in an actual like inpatient setting. So with people that were intubated, that had trachs, that were very medically fragile. So like we said before, like you can make the most of it, get some more experience, save up some more money because we all know grad students ain't the richest people around.
Nope.
So I
Most
mean,
of the time, that is not the case.
you can have a little, extra dough to spend as a grad student.
And that's the thing. Like I was especially lucky just because I had a really good job, like outside of occupational therapy. So I was able to support myself through that extra year and walk away with a little bit of money set aside for this new adventure. Made the move easier, made everything just a little bit easier and less stressful. So, don't just like sit on your hands for that extra time if you do get rejected. Just find ways to subsist and better yourself and just come back even stronger next time around. So like this can be done. People do it every day. If OT is really what you want, like, and you take the necessary steps to make yourself a viable candidate, you can do it. Just be patient with yourself, and see what you're capable of. There's you don't have any chance if you don't try. So just keep at it and see where you end up. So that's I know that could be perceived as kind of a heavy note, but the next thing I wanted to talk about outside of the admissions process is what happens when you actually get into OT school. We recently finished up our first year, and I just kind of wanted to talk about our experiences so far, what it was like first showing up to the program, how the first couple of semesters treated us. It's a big, big topic.
How much time do we have left?
Well, we've got enough time for the TLDR version. We can go into, and I will say, in future episodes, we can go into more detail about like classes, individual classes, and things like that. Let's kind of focus in a little bit and talk about orientation day. Let's start there and see where it goes.
I have secondhand anxiety.
Yeah.
Oh gosh.
I was so nervous.
Yeah.
But like so happy at the same time because I was just like, I've mentioned before, like my sister's an OT, and so she just told me like, you are going to make some of the best friends of your life in OT school because that's what happened to her, and she loved it, and those people that she met in her program are going to be in her life for the rest of her life. And so I kind of came into it thinking like, like I'm going to meet so many great people, and I did. And so, but the first day, like when you walk in, you just don't.
At orientation.
Yeah, not at, at orientation. It's just like
I don't think any of us
like
really
overwhelmed.
hung out
Well, it's
on
tough to
orientation
it's tough
day.
to just suddenly be dumped in a box and
Yeah.
say like, all right, these are the people you're going to be with for the next 2.5 years.
Yeah, and I think
Yeah.
we should add on a disclaimer that the three of us are probably not the most extroverted people
No.
in our class.
We're really
and
not.
so once we found each other, like obviously we're people, like we are people persons. Is that how you'd say people persons? Like we like people.
people
we like
people.
we're people people. Yeah.
Well, yeah,
Like
and-
we
and-
like to work with people, but we also kind of like to hang out in like smaller groups of people, more low key, and some of the people in our program are still very much into, you know, going out and going out for drinks like downtown. And yeah, I like to do that maybe once a month or something like that, but
Yeah.
that's not really how I describe fun.
Yeah.
So
Yeah, me too.
when I was like
Me
when I
neither.
found these two and a few others, like I just really felt at ease, like and
Yeah.
knew that even under the stress and all the tests and all the studying and papers, that we could find solace in hanging out with each other and just decompressing and
Yeah.
talking about the topic. So although maybe that didn't happen on orientation day,
Well, yeah.
it's
that's-
good to know now.
Yeah.
Again, it's not something that's going to happen just in a blink of an eye. It's
Yes.
really not. But I mean, really, you put it best. I remember like our whole class had kind of a group chat that we started
Yeah.
off very early on. I think it was the first day.
Yeah.
And yeah, a lot of
Yeah.
our classmates were like, "Oh, we're going downtown to party." I'm like, "Oh God, all right." But no, then
Yeah.
Talk about it now, like we all thought the same things, but
Yeah.
since
We had a
we
very-
hadn't, you know, actually talked to each other, of course, like
Yeah.
we all kind of in that moment we kind of like felt alone, but
Yeah.
now looking back on it, it's like
Yeah.
Well, that's the thing,
we
like-
all felt the same way.
Well, exactly, and that's really it. Like like over time, if you're patient, if you put yourself out there, you're gonna find people with similar interests, and it's gonna happen pretty organically, in my experience. Like I know, like I remember when I just noticed in the group chat, you guys like people were going out, and you were like, "No, I'm sorry, it's D&D night," and I was like, "Really? Tell me more."
I think I found my people.
Exactly. Like it's just like at first it like because that's how I felt when I first showed up. I was like, oh man, I'm like, it's just gonna be me and a whole bunch of party animals. But like there are people sitting in the same room as you who are going through that
Yeah.
same process.
Yeah.
Everyone's going in there nervous, and everyone's
Yeah.
looking to make friends usually, and like everyone just wants to be accepted.
Yeah.
And so if you go in just knowing like you're not alone, everyone's nervous, it's
Yeah.
fine.
And like you went through, or like everybody there went through the same admissions process that you did.
Yeah.
Like something that our program drove home, and I think still holds true. Like you're sitting in that room, you earned your spot there, and remember that. I mean, if you're used to being a big fish in a little pond, I mean, I'd recommend getting used to being, you know, among your peers and being comfortable with that, with operating on that level and working with people who are as dedicated and smart and, you know, professional as you are. But yeah, just know that there's nothing that any of those people have that you can't match. You're each going to have different talents, but you deserve your spot there, and you can stand on your own 2 feet. Now, I would recommend, you know, do find the people that you like with similar interests to you. Because I'm not going to say OT school is impossible to finish alone, but it's going to be a much better experience if you have friends in your corner who are going along the same path as you, are going through the same challenges and taking the same classes. It's going to make your life a lot better.
Yeah. And that's something I also like that they emphasized at first, was that OT school is not a competition. It's
Yeah.
not like other programs like med school or law school. I hear a lot that
Yeah.
those students kind of have a, like, we got to compete with each other. Who's going to make the highest grade? Like,
Yeah.
obviously there are very type A people in our class that really care about, you know, making A's and
Achievement.
achieving,
Yeah.
but we still all as a class have a lot of study sessions together, and like it's really, I never really feel that overwhelming pressure, like, oh, I gotta outperform. Like we all lean
Yeah.
on each other. And as someone that came from an honors program, and I like went to a math and science boarding school where there's like super competitive people, I will say that I was very like comforted and surprised when I realized that people that go into OT are overwhelmingly very kind and love to help people.
Yeah.
And so I feel
Yeah.
like if you decide to go into this profession, most of the time it's a pretty good chance that you're going to be, someone very empathetic and someone that really wants to take care of people, and because that's the whole thing with occupational therapy that we always say is, that they really look into the person themselves, what they want to do, the occupations that are meaningful to them. And so it's really meant for people that are interested in health science and the medical profession, but are also very invested in the person themselves.
Yeah, I agree. Yeah, I talk to some of my friends sometimes who are PT students or who were PT students and are now practicing, who do talk about kind of that cutthroat environment, like who's going to be the best, who's going to make the top grade. And I don't know what it's like in other OT programs. I've only been to the one. I will say that was not the case for us, thankfully. Like, we're very cohesive for the most part. We all work together. I mean, there are going to be people that you butt heads with. That's just life. It is impossible to be liked by everyone.
Especially in a high stress environment.
Yeah, stress brings out the worst in people, and there are going to be times where you don't get along with somebody. Maybe for like a long, long time, but really, in the end, everybody works through their stuff, and you can come through it as a team.
Yeah. And what's really fun for me is seeing already just everyone in our classes kind of specialties and like what they're interested in, because that's what they also really emphasize on the first day orientation is like, look around. These people are going to be your resources in the future.
Oh, yeah.
So the person that's really good in Jerry or really good in pediatrics or with certain conditions, you have them in your phone and you can call them up and ask for advice.
Oh yeah.
So it's really fun for me to kind of speculate where everyone's going to end up and just be like, ooh, I gotta save that person's number for sure.
Yeah.
And that's the
not
thing.
delete.
I think you've really hit on like what I consider to be one of the most important things when it comes to the difference between a program like this, where everyone is, cohesive and cooperates and works together, versus one of those cutthroat programs. When you actually get out into the working world, nobody cares if you're the best. Nobody cares how smart you are. Nobody cares what your grades were. Like, at the end of the day, all that matters is your ability to work as part of a team, as, part of a unit.
Yeah.
And
Multidisciplinary team.
Yeah.
Yeah.
It's like such a huge thing in hospitals because you do not want to be the person stepping on the nurse's toes or
The diva. That like,
yeah. If you're working in a rehab clinic,
Someone
if you're
with
working in a
attitude.
hospital,
Yeah.
like, everybody's smart. Like,
Yeah.
it doesn't set you apart at all.
Yeah.
And like, when it comes to school, if you're coming out of a program, if you've graduated and you're about ready to hit the working world, having a pre-existing set of contacts, maybe like, 20 to 30 people that you know from school who are all going into the same field as you, having that network set up ahead of time is such a big deal. It is going to help you immeasurably when it comes to getting jobs, when it comes to having resources to call on if you're working on a case and you feel stuck. Having that network is one of the most valuable things for any professional. And yeah, a program like this where everybody works together can really help you build that and really get a jump start on that. Because who you know matters. I mean, I don't want to treat it like the end all be all, but it's at least 50% of the equation. And it's going to make a big difference. All right, so we're getting close to the end here, but before we go on, before we talk about anything else related to our program, I want us to touch on our perceptions of OT so far. Having been immersed in it for a solid year now, some of the things that we think are the best things about occupational therapy, and some other things that really need improvement, or you feel like could be improved, or something that we might be able to change or add to the profession once we get out there. Any thoughts on that right away? Because I know for me, I mean, when I think about the best of occupational therapy, I think about really, again, I hate the word, but the holistic approach to health. And again, that's not meant to be like a hippy dippy, touchy feely sort of thing. I think really what OT does better than I think any other medical profession is, helping people like account for every aspect of their health. We're not just looking at their physiology or their illness, we're also looking at their family structure, their friends, where they fit in the community, what type of hobbies are important to them, what types of other activities are important to them, their job, really every element of who they are, we are supposed to take into consideration when it comes to treating them. And really, I think that's the best way to treat someone, because the physiology, the illness, the deficit, whatever is going on with them that brought them to your clinic or your hospital, that matters. But if you don't take into account the whole individual, really, you're going to be significantly less successful. You guys have anything to add to that?
Yeah, I think OT is really good at filling the gap between, just looking at a person's physiology and like what their physical deficits are or cognitive deficits are, and just filling that gap between like that and who they are as a person, and just making them function in their environment the way that they want to.
Yeah. I think a lot of other health professions aren't always the best at that.
Yeah.
Like, I'm not gonna.
They're too busy. They're too busy doing other things. Like there's nothing. OT just fills that space so well that other professions just, they don't have the time or resources to do that. Really, honestly, that's just what it comes down to.
Yeah, and that's the thing. I'm never trying to take shots at other professions, because
yeah.
We all know that we all work best when we're working as part of a unit, as part of a team. We each person, each profession makes up for the other's weaknesses. So yeah, I think we handle the human side of things very well. Whereas I feel like you look at something like medicine or like PT is very much, physically minded. It's very much thinking about, conditions and function, and the person, the thinking, feeling person kind of gets lost behind all of that. So I think we're good at kind of keeping the human element alive and well in the medical field. Now, any criticism I bring when it comes to occupational therapy comes out of love, because I love occupational therapy and I want it to be the best that it can be. And I think one of the things that comes to my mind when it comes to OT is something we kind of touched on in the very beginning, is notoriety, is, public understanding and recognition. I do really believe that PT has done more to kind of establish itself in the public consciousness. I think as occupational therapists, we don't have that recognition. I think some of that is due to our own, a lack of putting ourselves out there as a prominent profession. Of course, that's easier said than done, but going forward, and part of what I wanted to do with this podcast was just kind of put the occupational therapy perspective out there for people to see and hear. And I think the more people understand about OT and recognize about it, the more good we'll be able to do.
Yeah.
And so that's kind of where I'm coming from.
I think your perspective too is very valuable, especially considering just historically occupational therapy has been a lot of females, like very female populated.
I think the previous, I don't know if these metrics have been updated, but I know in the US, I think it's about 9% is male, and then 91% is female. So it's a fairly female-dominated profession, which, if anybody's wondering, is kind of the reason for the name BrOT podcast. Our program has 28 people.
Yeah, 28 and 6 are
guys.
and 6 are guys, and that
Yeah.
from my experience from talking
That's
to
huge.
other
That's
a lot.
actually a lot.
yeah, I've
That's a
talked to
lot.
other programs that have like 40 women and 1 guy.
Yeah,
Mm-hmm.
that's
It's
how
a
my sister's
very-
program was. There was one guy.
Yeah.
Yeah.
So it's like we have actually, even though we only have 6 people, it's a very disproportionate, or six men, excuse me. Everyone's. But, we even though we only have 6 men, that's still a pretty huge number in OT terms. And yeah, amongst the 6 guys, we call ourselves the BrOTs,
Yes.
just as a way to kind of, be proud and set ourselves apart, and
If the listeners are wondering, we are not BrOTs.
the,
Me and Gabby.
yeah,
We're just guests on the BrOT podcast.
oh well, no.
He's
I
kind
like
enough
to.
to let us on.
No, I like to hope that you guys are here for the long haul, but I mean, me as the unofficial official host, I guess I am the resident BrOT here today. So that's kind of little bit of a
Yeah.
little bit of insight into the title, but yeah. So I think going forward, the main thing I want to bring to occupational therapy is, and it sounds like something that kind of undermines the point of OT, which is being more human, more touchy feely. I want to do that, but I want to do that in a calculated way. I feel like too often with like occupational therapy, especially when it comes to how we portray ourselves to the public, we can come off as very like, OMG, hashtag blessed.
Yeah.
Whereas I want to look at the whole person, but I want to do it in a controlled, calculated way. I want to treat the situation like an equation and factor in every aspect of that person into how I treat them.
Yeah.
So I want there to be a method, but I do respect the human element that OT brings.
Yeah, that is a good point. That a lot of references I do see to OT are very like feminine, lots of flowers, lots of, like I feel like that can be
Like crafts,
confusing.
arts and crafts.
Yeah, arts and crafts, and
Which is like there
Yeah.
was an arts and crafts movement that we learned about in foundation.
Yeah.
So
Yeah.
it used to be a lot of that.
Oh,
and
don't
I
worry.
think
And I think in the next episode we'll be talking a lot about individual classes,
Yeah.
like foundations,
Yeah.
and neuro, and stuff like
Yeah.
that.
yeah.
But,
so I mean I think it would be a good contribution to the profession to kind of revamp exactly how we portray ourselves, and how patients and people see us.
Yeah.
Like I think we shouldn't be seen as the flowery
Yeah.
professional. It should be just another profession.
Yeah.
Yeah.
Like
I mean, we want to stand out for what makes us strong, but at the same time, like I think presenting that in a balanced and calculated way
Yeah.
is very important. And of course, like my opinion is not the end all be all. Every OT who goes out there is going to have a different approach to what they do, and I think
Yeah.
together, like I mean that's kind of life. Like my ideas are flawed, everyone's ideas are flawed in some way, but working together, I think we can all find all together we can find a solution that
Yeah.
we can make up for each other's weaknesses and figure things out and make the profession better
Yeah.
as a group.
And like every therapist has their own flavor, so to speak. But like I think it all has to be based in reason and evidence, and like it
Yes.
has to be backed up. Like
Oh,
if
yeah.
you are the flowery, girly OT, like there's nothing wrong with that, but
Yeah.
you have to have the evidence to back it up, or else it's
Well,
just
exactly. And that's part of what makes OT special. I don't want to do away with that at all.
Yeah.
I think, maintaining evidence-based practice and using that as our guiding light
yeah.
is the best thing for the profession in the long term. But guys, I think that's all the time we have for today. Hopefully we'll be back with another episode real soon. I want to thank Gabby and Callie for joining me today.
Well, thanks for having us.
Yeah, I hope you guys will be back either next time or sometime in the future. And thanks for listening, guys. We'll be back real soon.